Pancreatic neuroendocrine tumors have, again, developed some really great targeted therapies in addition to cytotoxic treatments. What's next on the horizon? So there are a couple of novel therapies that are very unique to pancreatic neuroendocrine tumors. The first is peptide receptor radiotherapy, also known as PRRT. Our European colleagues have actually been doing this for a couple of decades, but there's never been prospective randomized data to tell us that this is the right therapy to do. And again, our patients can live for years, and the potential for long-term toxicities is rare but very serious when it comes to PRRT. And that's namely kidney toxicity, renal toxicity, and bone marrow suppression. So it's rare, but there's a serious risk of MDS and leukemia. So that's probably about on the order of 3%, but for our patients that could very well live for years, that's a scary thing to have. So we are actually testing at Memorial a sort of second or third generation PRRT that we're hoping to have the trial open in the summer, using a little bit of a modified type of PRRT, which is a serotonin antagonist as opposed to octreotide, which is a serotonin agonist, to see if that's safer potentially, because we believe that it may deliver more peptide receptor radiotherapy to the tumor as opposed to the bone marrow and the kidney. So preliminary data suggests by delivering the therapy right to the tumor, you will have less toxicities, which hopefully would result in less long-term toxicities. In addition to that, there's a lot of interest in immunotherapies, just like in other solid and heme malignancies. The trials are ongoing. There's a very small study that they're doing in Stanford looking at CTLA-4, which is an earlier compound for immunotherapies. And particularly in high-grade neuroendocrine carcinomas, there's been some early data that suggests that maybe that would be a tumor type to emphasize the role of immunotherapy. So some data coming out of Europe right now and some preliminary data that potentially suggests the role of immunotherapy in high-grade neuroendocrine carcinomas, but those studies have yet to be done.